What's going on, everybody? This is Black Men Sundays. I'm your host, Corey Sylvester Murray, and we're talking about generational wealth, mental health, finance, and business.
It's a Black Man Sunday. Time to put all childish things away. I refuse to be the man I was yesterday. Gotta put my best foot forward and elevate.
And this is our Christmas show. We're speaking with Dr. Izetta Briggs Boland. This sister holds a doctoral degree in social work. She's also a licensed clinical social worker. She's a licensed mental health counselor. And this sister is a master CASAC credentialed alcohol and substance abuse counselor, credentialed with a specialization in problem gambling treatment. We're going to find out all that's about today. And this sister also focused on the needs of mental health, substance use, and physical health concerns. So without further ado, Dr. Izetta Briggs Boland, welcome to Black Men Sunday. Sister, how you doing?
Hello, hi. Well, thank you for having me and welcome everyone.
What does that doctoral degree represent? What does that mean in the mental health community? Just tell us about the doctoral perspective in the specialization.
So the doctorate degree is an advanced degree. So it means that I went further in my studies and I actually specialized in mental health and substance use. When the opioid epidemic really took a significant toll on the African American community, and it was not being addressed in the same way that it was being addressed in other communities. And I wanted to make sure that social workers had an understanding. First of all, in all communities, social workers were not prepared to address the needs of individuals impacted by the opioid epidemic. And we needed to change our trajectory. Our treatment methods were antiquated and they were not addressing the new needs of individuals seeking substance use treatment. And it needed to be inclusive of mental health concerns and physical health concerns, because this particular opioid epidemic of the 2000s was as a result of the change in the way opioid medications were prescribed in different communities. So it was a occurring condition, and it needed to be treated in a different way than it was treated previously, even though substance use as a whole needed to change anyway. This really brought it home that the way we treated substance use, there needed to be an overhaul of treatment in that area.
How do you feel that social work, because our show is about generational wealth. So how do you feel that social work professionals impact generational wealth?
Social workers as a whole, we address mind, we address the mental health, we address the body, the mind, body, and so emotional, physical, mental health. So we address the entire person, and it's different fields focus on specific areas, and we address the entire person and their environment and in their environment. So an individual, if they're dealing with mental health, if they're dealing with substance use, they're dealing with physical health, we also address where are they living, what's their environment, are they eating? So we address the entire person and what all of their concerns might be, and what their concerns were before, and what their concerns might be after whatever the current intervention might be. So yesterday, today, and tomorrow. So being inclusive of the entire person. And so if they came from an impoverished situation, so I'll give an example. If someone comes into treatment and they were homeless, so to provide clinical services to someone and then treatment ends and they continue to be homeless, we have not really addressed one of the primary factors of that person's life. So ensuring that they are connected to some service that will provide some type of housing, that is impacting their wealth. Because if a person doesn't have housing, then their poverty level is unacceptable. So they cannot build any kind of wealth without having a place to live, whether it be an apartment or whether it be a room. Just having a place to live is creating an ability for them to start from that point and to grow from a financial perspective.
Okay, gotcha. And let's take it back for a second. Like, what made you decide to get in the field in general, and then what made you take it to the doctoral level? Because we've had sisters on our show with a bachelor's in social work, master's in social work, but we've never had anybody take it to the doctoral level. So let's just take it back, and what gave you interest in the field and what made you take it to this level?
It's almost like my career kind of went a full 360. And I mean literally a full 360. When I first started in the field, I was working downtown Manhattan, and I was working with individuals impacted by the HIV epidemic. And these individuals were dealing with substances. They had criminal backgrounds with mental health concerns, and they also had physical health concerns. And my role was to ensure that services were provided for them in the hospital, respecting their dignity, making sure that services were provided in a manner that respected their dignity and worth as a person. And I was very new in the field. I was in my 20s. And I was in school at the time earning my bachelor's degree. So that respecting the dignity and worth of a person just carried through with me throughout my education. And at the time, so the piece that you don't know is that at the time I was in school, I did obtain a degree in a bachelor's degree in psychology, but I was also in school for business. So I obtained a master's in organizational leadership and a master's in business administration. And then I came back to the clinical work of it. But the business part of it is where I really thought my calling was going to be. And somehow it came back around to being in the clinical world, but I merged the two. So that's where my passion for the clinical work began, was just wanting to honor the dignity and worth of everyone that I came in contact with. And my career continued with individuals that just somehow found themselves in situations where they needed to have an opportunity that they could rebuild and regain their lives. And it just starts at when you give people the foundation, the basic foundations of life, they can become anything that they desire to be. And usually they supersede any expectations that you might have. I kind of wanted to understand more. I went back to school to get my master's in social work because I really wanted to understand the correlation between substance use and mental health, because I realized that it was a revolving door. It seemed to be a cycle of individuals coming back, and there seemed to be, it was, oh, if you exhibited mental health concerns, then you went through this door. And if you had substance use, you went through that door. But people needed to be treated simultaneously so they could actually recover. And at that point, the field was not equipped to deal with the co-occurring population. So as this tri-occurring cycle was funneling into the system, I wanted to ensure that people were equipped to deal with this next level that was coming in. And as a woman of color, I saw that it seemed like there was a different treatment track for certain people than others. And I just wanted to make sure that I had an idea, and I had an idea in my mind, and I just felt like this could be something. And when I went to school to get my doctorate, the professor that I asked to assist me at the time, because it hadn't hit the East Coast yet, told me that my dissertation was not appropriate and said, I'll let you do this, but I don't think this is going to go anywhere. And as I was graduating, reached out and was like, oh my God, this is so big. This is going to be so big, because it finally hit. But I was in the field and I was on the ground, and I knew what I was seeing and I knew what was happening. And by the time I finished, 3.5 years later, the whole country was it was kind of on fire because people were dying. It was the epidemic had exploded. I saw it coming, and someone that I worked with before, when they so it goes back, there was when they decided that pain in the medical field, when you ask people about their vital sign, it became the fifth vital sign, and they asked people about pain, and they just started writing prescriptions as to people's level of pain. When they decided that was that was one of the vital signs, we were at the table and we said, this is going to be a big problem because they're going to be writing prescriptions based on the level of pain that people say they're in. We knew at that point that it was going to create a problem in the country, and it did exactly that. So being on the ground and seeing and being in the field at the right time, it just gave me the insight as to what was happening, and I decided to get my doctorate, and that was the field that I chose, and I was right on with what was about to happen.
Wow, yeah, that's interesting because I live down in Orlando, Florida, in Brevard County. It's like Melbourne area,
Yes.
Cocoa Beach, those areas, man, they got hit really hard. Like we were doing like our specials where people, they would go in to the hospital, get like a back surgery, then they would get some pills, and the pills, the doctor wouldn't
Mhm.
give them anymore, then they would take it to the street level, and they were shooting them up. So that's real interesting. And that kind of leads to my next question, because we're talking about it's the holiday season, and when we talk about mental health, I was actually doing some research before I came on here, and it said 3 in 5 Americans feel mental health is negatively impacted during the holidays. Well, what can we do from your point of view, from a clinical perspective, to kind of, ease that holiday pain?
I think the first thing we could do is just to acknowledge that it's not always a happy time for everyone. And I think that we just automatically assume that it is. Everyone doesn't have family. Everyone doesn't have someone that they love, or either that they feel loves them. And so to just kind of be mindful of that, not to make someone feel that they're wrong for their feelings. If a person expresses that this is not the happiest time for me of the year, to acknowledge that and let that be okay for that person, and maybe ask a question and not say, well, why not, and try to make them see the good in the time. To just acknowledge that that person's thought or their feeling right now is valid, and to validate it for that person, and maybe share in that moment and just receive the information and not try to change the information for the person.
In doing my research, I saw it said people with mental illness say the holidays is the worst time of year.
Mhm.
Can you just, elaborate on that for us?
Sometimes, if you think about it, a lot of things, bad things that happen to people, happen during the holidays. If a person has experienced or witnessed domestic violence in their home, a lot of times they will say it was during a holiday event. Family members came over and things were going well, and then everybody was drinking because it was festive, or this happened or that happened, and then things took a turn for the worse. If a person says that they were molested or abused by someone, usually, I don't want to say usually, a lot of times it may have been by a family member that was trusted. When did this occur? At a family event, at a holiday. So a lot of memories, a lot of different things could have occurred during holiday events, or not. Just the fact that this loved one is not here, and now I have to go through the holidays for the rest of my life without this person that was very close to me. One of the things that you can help a person to try to do is maybe recreate events going forward that may present or to help them to develop more memories that may be happy going forward. but to also acknowledge that, give them the space to share what is not happy about the event. Because sometimes people want to gloss over that and not allow that person to share what their feeling is currently.
Great information. And, speaking on your credentials, like I said, you're a credentialed alcohol and substance abuse counselor with a credential in specialization in problem gambling treatment, which I'm kind of sitting here like, wait, hold on a minute, because, it's Christmas time. I'm gonna have me some eggnog. I might put a little bourbon in it. You know what? I'm gonna be on my app. Is LeBron gonna score over 25 more or less? Yes, I'm gambling, I'm drinking, but at what point is it a problem versus, okay, I'm just being festive?
So it's based on different life circumstances. So it becomes a problem when a person can identify it impacting certain life areas. Did it impact your work? Is it impacting, so one of the main indicators is your family saying that it's a problem, especially with gambling? Has your family expressed to you that they are concerned about your gambling? And one of the other questions with gambling is, have you felt the need to lie or hide your gambling from others? If you answer yes to one of those questions, it's something for us to take a look at. And with the alcohol, there are a few other criteria, but family members expressing concern about your drinking. Is it causing concerns for you at work? Are you drinking and driving? Are you thinking that is your impairment, are you unable to recognize your level of impairment being too much? Does someone else have to say to you, I think you've had too much? Are you able to set a limit for yourself and stick to that limit? Do you recognize that your behavior is problematic when you drink? So a lot of it are, there's specific criteria. Do you become angry? Do you become reckless or violent, or, those kinds of things are to take a look at. There are people that they get to a location and they say to themselves, so that I give the other side, they say, you know what? It's Christmas. I haven't been drinking. I want to have a good time. The keys are over there. The car is not moving. I'm going to enjoy myself. And when I finish, I'm going in the back. I'm going to sleep. I will get up in the afternoon sometime, take a shower, and then leave. That's not problematic drinking. It really is based on a criteria.
Yeah, because I was gonna say, it's the holidays, we chilling, we got a couple weeks vacation. I want some eggnog, I want to have a good time. But how do we know at what point? And that's where it's like, when I speak to brothers and sisters, like, at what point is it too much? At what point are we overindulging versus just having a little something, having a good time? Especially, you haven't seen family members in a few years. You might want to have a couple with them. That leads to my question is, like, when we're in the holidays, we talking to family, we building, we having connections. How do you know when? I mean, we know when the too much is too much, but I'm just saying from a clinical perspective, and that's what we on today. How do we know that, okay, that this is deeper than just some Christmas eggnog? Like, this is deeper than that. How do we know that it's a problem?
From a physical perspective, your body will tell you that you're drinking so much that you're poisoning yourself. If you start to throw up, to regurgitate, then you've taken in enough, you've consumed enough alcohol that your body is now bringing it back out. Or if a family member is starting to get sick, then it's time to help that person to stop drinking for a period of time, because alcohol, the alcohol content has to reach the bloodstream and then come back down. So even if the person is like, oh, I'm good, I just went in the bathroom and I'm okay, then then others need to say, no, you need to just chill out for a little bit of time. You need to chill out for a while. They have now consumed more than their body is really able to to process.
But when we're talking about like mental health and the holidays, a lot of brothers talk about, from a financial perspective, they had XYZ saved up, they bought these gifts, they need to travel, it's a lot of money being spent. So from a mental perspective, like what can brothers and sisters do financially to where they're not being triggered from a financial perspective?
I think this is really important, especially for us as African Americans. During the holidays, I think that we can love one another and care about one another and want to do for one another and show our love to each other and not have to put ourselves in a financial, for lack of another word, not put ourselves in financial ruin. I should be able, if I'm traveling, then if I come to your house every year, then I know that I'm coming to your house every year. So I should be able to plan accordingly and know that wherever you live is this far from where I live, and I should be able to get my ticket ahead of time so that I'm not like maxing out my credit card 2 days ahead of time to get to your home and putting myself in jeopardy at the end of the month. If there are people that I want to get something for, then maybe, get something that's affordable and not try to buy gifts that are not affordable. Or maybe as a family, we could come up with, let's do Secret Santa, and we set an amount and everybody will get a gift, but the gift will be an affordable amount and everybody will get something. We'll all feel good about what we've done, and no one, and we're doing it in a way where we're doing it with love, and we're doing it in a way where we're acknowledging that some people have more than others, and no one is going to feel bad about themselves. And we're doing it in a way where we are being considerate of the entire family and everybody's financial status.
You have over 3 decades where you focus on the needs of mental health, substance use, and physical health concerns. So my question for you is, how are you assisting mental health organizations with, medication assisted treatment services? Let's talk about that. I think that's really a big deal. Let's talk about that.
To have been in the field over 3 decades, treatment as a whole, when it comes to mental health, substance use, and physical health, it has evolved. And to be in the field for so long, I have been at tables to help. I've been at the table to help treatment evolve and help these conversations evolve. So before it was kind of so I'm also a harm reductionist. So if a person came in and they were, you come in and you meet me. Okay, you meet with Dr. Bowling and we're abstinence-based. So I say to you, as of today, you are not to have another drink because this program is abstinence-based and drinking alcohol is against our procedures. It's against protocol. So if you have a drink, then you are out of compliance and you are not part of our program. So if someone is struggling with, the reason they're here is because they're struggling with their alcohol use. So to put someone under that, to confine someone to that, they may not be able to adhere to that. So what happens to that person? They're in need of help, they're in need of treatment, but because they're unable to adhere to the guidelines, so they get discharged and they can't come back for however many days because they drank, which is their reason for being here, is that they cannot control their drinking because they have a drinking problem. So the field had to change. We had to evolve and meet people where they are and help them to understand that the reason they came in is that they realized that they need to make some changes in their mind. It starts in your mind. All change begins in your mind. And sometimes people walk in and they don't think they have any reason to make a change, but through conversation and through dialogue and through looking at some of the things that we talked about, well, your family is saying that, when you drink, these are some of the behaviors that you exhibit, and helping a person to look at some things that they may not have even recognized yet. And through conversations and working with a person from how they walk in the door and helping to move the needle forward, a person may begin to be ready to make some changes and inviting more people in and inviting more people to the table, you may actually see progress with more people than the few that came in and were able to make a change right away. And more lives are saved, more lives are changed, and to move forward to wealth, more people are able to become productive members of society and ultimately be able to take care of themselves, their families, and ultimately establish some wealth going forward.
Nice. And you transition is so smooth for me. And let's go and talk about this wealth for a minute. So do you do any investing? You own any properties? Let's talk about that.
Yes, I own a few properties. I do invest. And I will say, as a young person, I didn't really know anything about investing. And someone said to me, I was getting my first like professional job. I think I was like after getting my first degree, and someone said, before you get your first paycheck, if they have a 401k, if they have anything that you can put money towards retirement, do it. They were like, even if it's $25 a paycheck, do it. You will never miss it. And you've never seen it. So just do it. Do it for yourself and give yourself that opportunity and don't ever look back. And I did it. And there was a point in time, this was years later, where I wasn't working. I think it was 3 months. I think I was in my early 30s. So from my 20s to my early 30s, I just was letting whatever that money was go into there. And I was like, I'm not working. Let me see what this did. And it did quite a bit. And so I was like, wow, this really works. And so then I began to, and then at that point in my 30s, I was able to purchase my first home. And so I was able to, and I didn't really know what I was doing or how this thing worked, but they said, no, you can borrow from this and put this money towards the down payment of your first home, and then you pay yourself back. And it was like a really small amount of what I was already putting in. So it was like, well, wait a minute, I could use my own money to put down towards this and then still have the same amount of money in here. So then I was learning how to use my own money to increase my own wealth and continue growing money towards my retirement whenever that would be. And I was still quite young, so it's not something I'm thinking about anytime soon. And then I was able to do it again. And then I did it again. And I actually, when my sons were growing up, I started teaching them how to be responsible with money. And it was done very subtly. It wasn't like I'm sitting you down and I'm telling you how to be responsible with money. I would just give them money and I would just stand back and watch to see what they would do with the money that they were given. Because what I noticed was, if they're spending my money, it's a big difference on how they will spend my money than how they will spend their money. So when I took them places, I would say, well, this is the amount of money that you have, whether it was for school clothes, for whatever, this is the amount of money that you have. And I noticed that they were a lot more frugal with their money than they would be with my money. And then they got to a certain age, they had to work at a certain age. Then we got them bank cards and then started getting them credit cards. And they're both not out of their 20s and they are both homeowners at this point in time. So it did rub off.
Can you be more specific? Like, after you purchased your first property, how were you able to get in the second and third property? If you could just be a little more specific with that.
So the second property, I still had the first property, and it was a question of, would you be able to, do you need to sell the first property to purchase the second property? And at the time, I thought about the cost of the second property because this was in the early 2000s and they were really pressing people to purchase these huge, huge homes. And you didn't have to have a lot of money, and which was interesting. You didn't have to have a lot of money to purchase these homes. And what we found out after the fact was like 2008, I want to say, there was like the housing crisis. And for whatever reason, I did not want to be house poor. I'm the type of person that I like to have nice things, but I like to live in and I don't know, some people wouldn't say that I live modest. I'm thinking of a specific person in my head. And they might say, I don't know about that. But it might look that way on the outside, but I'm very cautious of my spending. And so I said, no, I want to buy a house. I want to have a nice house. I want to have a bigger house than what I have, but I don't want a house that's so big that all of my finances are going into that house. So I chose middle of the road house. And I would say that to people, I would give that advice. Just because you can afford a home, don't buy the biggest house that you can afford. Because unless you need that house to really, really for the amount of family that you have, I would say buy the house that still keeps you within your 50% or lower income bracket for you and your family. And think in terms of anything could happen. So if one of our incomes are not here, could we make it if one person is on Social Security or on unemployment for a period of time? Could we make it while the other person is seeking employment or whatever? Would we still be able to make it? It's really important, and to make sure that you're able to save, because you might want to purchase another property for some other reason. And if you keep your first property, can you keep it up enough that maybe you make that a rental income or let that generate some kind of wealth for you as well? So be thinking down the road with your decisions.
This is Kalali Dobe. I'm up here. Yeah, just definitely appreciate the wealth of information you've been sharing with us. Is definitely wide open. I do have a couple of questions. So just going back to your expertise, in substance abuse and different things like that. I guess this is just a basic question. Like, so do you view substance abuse or addiction, such as substance abuse, opioid abuse, and even we talked about gambling earlier. Do you view those things as mental health issues?
It has been changed that they are considered under the mental health spectrum. So if you look in, and I don't want to get technical, but if you look in the DSM-5-TR, which is the mental health, which is our mental health book where we find all of the mental health, what they call disorders. It is in that book. So yes, it is under that spectrum.
Okay, so I mean, does that mean like certain people could be more like, I guess, predisposed to even something like a gambling addiction or like, or a drug addiction over other people? And I guess a follow-up to that is how could we I guess address or assess whether somebody's more prone to having these type of addictions or addictive personality or whatever we might call it?
It's evidence-based that people with substance use disorders and gambling disorders and even mental health disorders in their family history, when you're doing an assessment, you assess for these just to see if there's any correlation. But there's also there's environmental correlations as well. So there's like a nature versus nurture, but it could be either or, and it could be both. So we can't say it's 100%, but we would want to educate the person and say, from what you've explained to me, you said that your grandfather on your father's side and then your grandmother on your mother's side. So you might want to be cautious in reference to using certain substances. You might want to, you might want to be mindful if you find yourself having these symptoms of depression and educate the person on what they might be. Or if someone comes in and they present with certain symptoms, you might want to educate them and say, based on the information you provided, these are some of the concerns that you've expressed from your family history. And you were raised in an environment where there was a lot of this, going on. So, yeah.
Okay, thank you for that. Also, so like it seems to me like over history, like some of the, I would say like the epidemics have been like kind of like color coded. For instance, like we had the, crack epidemic, though that was considered more of like an urban epidemic. Now with the opioid epidemic, it's seeming more like it's being labeled as like like a rural epidemic, like more something that affects, let's say, affects like poor white people as opposed to, lower income Black people, and so I'm just wondering, is there a distinction there, or is the opioid epidemic really affecting like people across the board, across race? Is it really is it more affecting like the rural areas, or is there really an impact that we can see also in urban areas as well?
So initially, the opioid epidemic impacted non-people of color, because if you go back over history, we were not identified as people that really experienced pain. So pain medications were not prescribed to us at the same rate that they were prescribed to as others. However, once they realized that there was an opioid epidemic, then opioids were not prescribed as readily to people. So then it became a heroin epidemic. So heroin comes from where? It usually comes into the country and it was flooded into the urban neighborhoods and then dispersed. And so then that became more of a general epidemic. And then the fentanyl, which is now opioids again, started coming into being introduced into the heroin. But because the people that were initially impacted by the opioid epidemic were, and I will say a lot were females, white females, they were coming into the urban areas and being impacted, and then it was impacting other areas. And so that's how things got all mixed up. And so that's why there was so much, it became such a concern for America, and such a concern that we needed to address this epidemic. And then people started dying. Everybody started dying. And then fentanyl, and now xylazine. And it just, we can't keep up with the synthetic opioids that's coming in now.
So is it still considered an epidemic even now? Or is it, because like it seems like we don't hear about it as much anymore. So is it still considered like an epidemic now? Is it still something that's really serious, that's hitting communities hard? Or is it something that we're past? Or, and you're talking about synthetic, that's a whole other bowl of words. You start talking about synthetic drugs as well.
It's still hitting the communities very hard. People are still dying probably every day. We now have quite a few like medications, and like there's a lot available to people, but it's still an epidemic and we're still fighting it. And it's still very bad. Almost every family knows someone that has lost someone, or is dealing with someone that is dealing with a loved one that is either on opioids or has died, or at least has had an opioid overdose. They may not be dead, but they've had an overdose.
So, through your studies and, through, dealing with these kind of issues, do you have any kind of recommendations for like what, I guess maybe like local or state or federal governments can do in terms of like policies or legislation that might be advocated for that could help to curb this epidemic or address this epidemic?
I have to say, they have done a lot. So Narcan is readily available, and I would say everybody should have one. You never know if you come up up on someone and they're passed out, you don't know why they're passed out. If you give someone Narcan, it will not harm them. If they've passed out for any other reason than an opioid overdose, it will not harm them, but it could save their life if they have, and to immediately dial 911, because the newer synthetic drugs that are out there, the Narcan may not work because they need oxygen, but as soon as someone comes up, to just dial 911, but if you have Narcan available and you give it to someone, you can save someone's life just like that, and it just takes 2 seconds. You just go shoot, shoot, and that person's life could be saved. So if
Wow.
everyone were educated and just had it available on them, we all could be lifesavers and be heroes.
Great information, because, when you were talking about the Narcan, I worked for a news organization in Orlando, and I remember, the a lot of people, like I said, in Brevard County, which is like Melbourne, basically all the way up to Daytona Beach, Volusia, all that. And I remember the Narcan was a big deal, where all the police agencies started carrying Narcan. They even would give Narcan to dogs, because sometimes the dogs would be messed up too, may have licked somebody or whatever. So yeah. So, so we're very, very poised on that. But I definitely want to, before I let you go, outside of all of your accolades and degrees, the one thing that I see that we haven't discussed, it says CEO. So let's talk about, what made you want to be a CEO, where the idea come from, and then how did you execute that to make it a reality?
I'm a CEO in 2 different rights. I was a CEO of a nonprofit organization for 7 years. And I worked my way up to that position through a nonprofit organization. And it was a multi-million-dollar organization, and I was there for 7 years. And it was an interesting opportunity. And that opportunity ended. And I had always wanted to do what I'm doing now. And I actually still work for a nonprofit organization, and I have my own organization. So I wanted to develop a 2-tiered organization where I provide trainings to the community, but primarily to up and coming professionals coming into the community, where I instill in them the importance of working with individuals and making sure that we maintain that dignity and worth for each and every person that we work with, whether or not we're working with the community, because if the community is who we're working with, then we need to maintain the dignity and worth for the community. And there's a special way to do that, and to respect who people are and not try to come in and change who they are, but to come in and provide information and education to uplift that community while allowing them to be who they are, and to maintain the essence of who they are, while also providing services to individuals within that community, whether it be substance use, mental health, and integrated health, because people are dealing with grief. People are dealing with trauma. Since COVID-19, the world is different. People experience things that are coming and have come from being closed in and being afraid of not knowing what might happen tomorrow, and now trying to reintegrate into a world that's totally different than what they went into. And people are experiencing anxiety that they never had, fears that they never experienced. We're coming out into a new world, and people are really not sure of how to navigate that. And we talked about the opioid epidemic, but we didn't talk about the people using alcohol. We didn't talk about legalization of marijuana. I'm in the East Coast, the legalization of marijuana. And the reality is that the marijuana marijuana is becoming so potent that people that have underlying predisposition to psychosis are really becoming psychotic from smoking marijuana, and they're being hospitalized. And many people, it takes long-term mental health care to help them to get to a place where their brain restabilizes. And the people they're really afraid because they're not sure if their brain is going to return back to normal. Now, and then we also have a K2 experience that is happening, that is sweeping the country, and people are smoking K2, and that can cause psychosis in different people. So there are so many different drugs that are impacting our society. And then with COVID, people experimented with a lot of different things. And because people weren't able to get pure drugs, there were a lot of mutations of drugs that people experimented with and didn't know they were experimenting with. And all of these people are coming in for services. And we have to be able to help people where they are and provide quality services to individuals. And the services are taking longer to really get an understanding of what is occurring, and to help people to understand that this didn't happen quickly. So it may take time for us to figure this thing out, and to provide a safe space where they will continue to come back so that the healing process can begin, and to help family members to understand that, yes, this is a scary situation, but we can help you through this. Just stick and stay, and treatment does work.
Great information, but I'm just saying, like, going back to you from a business perspective, at what point did you realize that you would want to be a CEO and run your own company?
So my company is we're going into 2025. So it's going to be 22 years old. So I thought that I wanted to do something of my own, but I wanted to do something in a way that I would be able to reach people in a way that they would be able to receive it. Because sometimes when you're under certain regulations, you have to do things. Everything is regulated to certain extents, but in some ways you want to be able to reach people in a way that they can receive the information, and make sure that I'm available to my community and to my people in a way that they can receive it. And sometimes I have to be able to talk in a way that we talking, we chat, and I get it.
Great information. And I'm gonna ask you the real hard question now. Are you enjoying yourself on Black Men Sundays?
I am. I really am.
All right, good. Yeah, because I'm sitting here learning so much. And I kind of wanted, before I let you get out of here, I kind of wanted to go back on when you were talking about the opioids, the alcohol, but then you brought marijuana in. So it kind of made me think of a question. Like, do you think, as far as from like a psychosocial perspective, do you feel like because I felt like back in my day, the marijuana, like all the weed was growing outside. Like wasn't, now everything is inside with the, hydroponics and all that and the different mutations. Do you feel like there's a difference from a mental perspective, speaking clinically now, versus, the 80s, 90s where it was grown outside? Is there a difference as far as from like a psychosocial perspective?
What I think is that things like everything we do, if you look at what we could do in the 80s, you look at our television sets, they had the big backs and we had the cable boxes. Everything that we did then, they're able to do better. And they're able to, we are able, you're where you are and I'm where I am. You're in the state you're in, and we're able to communicate. We couldn't do that in the 80s in this kind of way. So everything is bigger and better. And so I just think that some people people have to be able to know what their limitations are. And so I feel like they're able to create marijuana that is so much more potent than what they were able to create back in the 80s. And that could be a good thing for some, and it could be a bad thing for some, just like with anything, as as we evolve, it can be positive in so many ways, and there could be negatives in so many ways. And it's unfortunate that a person won't know that something is not good for them until they experience it. There's no way for a person to know. And there are people, I'm telling you, there is a significant, the amount of people that are coming in to see me with psychosis, marijuana-induced psychosis, has increased significantly. When alcohol was legalized back in the 1920s or whenever, I'm quite sure there was a significant increase of people going into treatment for alcohol, either alcohol poisoning or alcohol dependence. So I guess it's a trade-off of the business.
You know what? I kind of want to go back to the gambling for a minute because, you know, I'm in Florida. You know, we've got the Hard Rock Casino. The gambling's been legal for a year now. You have all
Oh,
these different, yeah,
oh,
yeah,
okay.
yeah. You know, Florida, we slow. We get everything last. You know what I'm saying? But we have the gambling's legal in Florida now. We know we've got all the different apps where, you know, like I was saying in the beginning, you know, if I said if LeBron's going to score 25 more or less points, you can, you know, make a you can gamble that, you can, you know, predict that, you can put $20 up, $100 up, $100 give you 200, 20 gives you 60 and vice versa. But as far as gambling goes, because we're seeing it's a lot of, especially across state lines, it's a lot of gambling is really becoming very legal. It's almost kind of like easy as, you know, going online and ordering a Uber Eats to order
Mhm.
some food, but you gambling at the same time. But then at the bottom, when you read that small print, it says for people that need help gambling, call this number, call that number. So what can we do to where if we want to gamble, we're, you know, having a good time with it, but at what point should we sit back and realize, okay, this is becoming a problem? Because for me, I'm not gonna lie, like last Christmas, I hit pretty big. I put up like $100, won like 600. It was good. It was like, oh man, I'm doing it big. Got gifts and everything. But then when January, February came, when it's time to pay them cards off, I lost a lot too. But I knew when to stop. So I'm just saying from a clinical perspective, when we're talking about gambling, at what point should we say, okay, this is enough? Because you know, when you lose that money, you want to get it back. So the last thing I'm going to do is say, no, I'm not about to stop now. I need to double up and get my money back. But from your point of view, from a clinical professional perspective, at what point should we say, okay, this is enough?
What you just described with the, okay, I'm losing, I want to get my money back, I want to double up, that's considered chasing. So now you've entered into chasing your losses. So usually what a responsible gambler would do is have a set amount. This is what I'm willing to lose. And so if you've lost that amount, then you've lost that amount. And some people would say, okay, this is my amount. And then I got a little bit tucked away just in case. Okay. But if you've lost your just in case, then you need to accept that and you need to leave for the day. If you don't and you continue to play, you are in fact chasing your losses. Now you can't say you don't know anymore because I just told you. So now you're educated. You now know that you have started the behavior of chasing your losses. And then I told you what two questions, and these are the two questions that we ask for a gambling questionnaire. Have you ever lied about the amount of your gambling amount to family members, and have your family members express concern about your gambling? So those two things, if you ask yourself those two questions and you're saying yes to either one of them, then you need to be concerned about maybe your gambling has become problematic. Those are the first two questions that we ask someone.
Actually, I think about the cycle breakers. I saw that on your website. What's the cycle breakers?
So IB Cycle Breakers, that's the name of my business. That is my organization. And in 2003, when as I said, the field has evolved. It was originally Addiction Cycle Breakers. And that was the name of it, to break the cycle of addiction. And the logo it's a dove coming out of a cycle. And so we break the cycle with love. we've changed it because as this field evolves, to have the name addiction, cycle breakers could be breaking someone's anonymity just by having that name. So it's IB cycle breakers. So Izetta Bowling cycle breakers. So we've changed it as we have to evolve. So I am evolving with the field, and people come to me. I work with families. I work with, like I said, look, I work with communities. I work with individuals that want to abstain from any substance use, but I work with individuals that want to explore their relationship with substances. Because in America, people use substances. They use them for recreational purposes. And sometimes people realize that I am drinking more than I want to drink, but I don't see myself ever not drinking ever again. Or I don't want to drink ever again, but I still want to smoke. Or I don't want to use opioids, but I want to be able to have a drink with a family member. So I don't want an all or nothing lifestyle. And I help people to figure out what that looks like for them, because people have a right to decide what they want their life to look like and still live the best life that they can. And embedded in all of that is living a life of health and wellness, financial health and wellness as well. And if you're healthy, if you're physically healthy, then you need to be working. And then that means that you're financially, we need to explore what financial health and wellness looks like as well and obtain those goals.
What a way to wrap it up. Well, Izetta Briggs, Dr. Izetta Briggs Bowling, thanks for coming on Black Men Sundays. You definitely blessed the stage. I learned so much today. Thank you. Enjoy your holidays. And, this is our Christmas show. So Merry Christmas, sister.
Thank you so much for having me.
It's a Black Man Sunday. Time to put all childish things away.